Welcome to Real Recovery Unplugged, the podcast where healing meets hustle, faith fuels purpose, and real stories spark transformation. I'm your host, Dr. Haley Brown, founder and CEO of Real Recovery. I'm an osteopractor, entrepreneur, believer, and someone who's passionate about rewriting the script on healthcare one life at a time. Each week, we'll pull back the curtain and have raw, unfiltered conversations with our staff, doctors, fellow healthcare providers, athletes, patients, and inspiring voices from all walks of life. We'll also get a behind-the-scenes look at what it really means to build a movement, not just a business. So whether you're a provider, a patient, or someone chasing a purpose bigger than yourself, you're in the right place. Let's get into it. Welcome to Real Recovery Unplugged. I'm Dr. Haley Brown, founder and owner of Real Recovery 850, and your host. And next to me here is Dr. Nicole Richards. So Dr. Nicole is going to be a regular guest on the podcast, and she is going to help us dive deep down into all things healthcare, all things wellness, all things sports training, and we're going to pull out a lot of good nuggets and have a lot of really good conversations. So I think today what the point of this podcast will be is to talk a little bit more about Real Recovery Unplugged and where we hope to go with it, but mostly for you guys to get to know Dr. Nicole. So Dr. Nicole, who are you?
I'm a lot of things, to unpack. So when we originally met, I basically would have just defined myself as a physical therapist. Probably that had been my goal my whole life. I had come out of physical therapy school, rocking and rolling in it. That was my identity. And then I had 2 kids and I became a mom and thought I wasn't going to be a physical therapist anymore. I thought that was going to change my whole career path and I was going to get out of physical therapy because I had been burnt out by a lot of what I had seen through insurance and the whole burn and churn of what the physical therapy practice is like when you have to work for insurance or physician-owned practices, which is what I worked in. And then I got a call from you that was like, hey, you want to recreate your identity again? Because this kind of physical therapy is going to be a little different than the kind of physical therapy we first started doing.
Yeah.
And I was like, okay, that sounds good. I'm glad I did it because at the time I had 2 babies and I loved being a baby mama. But being a toddler mama is something a little different.
Imagine.
So now I am a toddler mama back into physical therapy. And I think it's given me a lot of perspective to be a better therapist. I was really in shape coming into my career. That's one of the reasons I wanted to be a physical therapist is because I didn't want a desk job. And I was an athlete. I liked how the body moved and didn't really actually have that many injuries myself or actually require physical therapy. But just having that love for anatomy and that love for movement really drew me into it. And because I was so in shape, I kind of had a perspective that I overdid my treatments a little bit.
Yeah.
Initially, I think that taking that step back, being a mom, becoming out of shape myself and learning time management myself, not having all the time in the world of just being a single go-getter, living at the gym, living it
For sure.
work, gave me a lot of perspective to be where I am now. So I'm really happy to be at Real Recovery, to have the perspective of not only where I've become in life, but also what you have created as a therapist, because it was a career that I was about to walk away from where I was.
Yeah. So let's give a little bit of background history
Sure.
here. The year was 2019, 2018. I think it was 2018.
Yeah.
So in the year of 2018, I was on my first summer of clinical rotations in PT school. And I had my first rotation in an outpatient clinic in a more rural area. And then I got a rotation at a certain clinic here in Tallahassee that is a heavy ortho clinic, heavy sports medicine driven type clinic. And, it was what I would have called the gold standard whenever I was in PT school. That was kind of like getting to go to that clinic was kind of like where pretty much everyone sports realm Tallahassee, they associate this clinic with that. And so I was stoked to have this clinical. And I went in there and met you, and you were super fun, passionate. Like, we got to have so many in-depth conversations, watching you do evals, watching you challenge your athletes in different ways. I was like, yes, like this is what I'm talking about. And then it was kind of interesting because after about a week of being there, I started realizing how different you were from the other therapists in the clinic. Really, I mean, you were also doing training at a gym here in town too. Mm-hmm. So I think you had enough of a mix up that you kind of stayed fresh and did new things. And I guess, you also really prioritized more of your one-on-one patient care and didn't use techs as much as the other clinicians there.
Right.
And
because I didn't do cookie cutter exercises and the techs would not know what to do with my exercises.
Yes. And I think that was the biggest thing, was learning the unfortunate side of healthcare, that a lot of health insurance, not a lot of, every health insurance driven clinic is all about productivity quotas and how many patients did the therapist get seen in that day. And, none of the pay raises, salaries, none of that was determined off of patient outcomes, correct?
Mm-hmm. Correct.
It wasn't, did the patient get better or not? Did they have a great experience with PT? It was, did they get in the door and get out? And then how many hours did you bill, or how many billable units did you get?
Correct. Unfortunately, what also happens is, when you're a clinic that's owned by a physical therapist, you know the ins and the outs of your reimbursement with insurance. And so even when it's a physical therapist run clinic, it's better than that. But being a physician owned clinic, unless you have someone who's truly understanding the ins and the outs of not having certain patients together and being scheduled together, because they're either not conducive with the type of therapy they need, or because billing will not work in that kind of way.
Right.
You're not being productive for each client or for your clinic. And so you run into this kind of, you're not helping the business and you're not helping the patient. And you just kind of feel like you're running into a dead end, no matter which way you go.
And I remember you would have like frank conversations with me, because I would come in and I would see, everyone else going through the mill, making their rounds. And so, it got to the point where I could look across the clinic and see a certain patient doing a certain exercise at a certain time and know, okay, they're about 6 weeks post ACL repair or something like that. And it was, no matter what sport that person played, or whether it was a young person or an older person, everyone was doing the same thing. You were the only person that was doing things differently, that would throw in things. And that would require you to have more one-on-one time. So I don't know, how you fought that productivity wise with your supervisors and, the powers that be, but it meant a lot to me, because here I was, my first clinicals, and I was already getting a little defeated by the system.
And I had been, I think, 8 years in at that point. Maybe. Wait.
And you were still fighting the good fight, like off to it. Yeah.
No, but I think that's why I also started to be a CI, was because I felt like by educating others and having a student there, it's also easier to tell the patient, hey, I know a lot. Like, and by having a student there and kind of not necessarily talking over their diagnosis, but in a way, coming to physical therapy to some people kind of seems like glorified personal training at some times. And especially when you're going into a mill kind of practice, a lot of people don't know with physical therapy how much knowledge we truly have, and that we are a doctorate level. And so getting that understanding from just talking to a student saying, hey, this is what's going on with your injury, and I'm going to talk over you, but I'm going to talk with you for a second here. And in that kind of light, I found that, it allowed patients to have a little bit more they were more comfortable to ask questions themselves, because it wasn't like I was putting them down for not knowing something, because it could be over their head a little bit, but then they could say, well, I don't understand that. And it wasn't, hey, I don't understand that because I don't know, personally what's going on, but you were talking to your student, they know what's going on, but tell me a little bit more. And then I would know that they're engaged about that certain thing, and I can have a better experience for the patient too.
For sure. Yeah.
So that kept me kind of sane for a little bit. And especially you as a student kept me very sane, because I had a mill of different kinds of students, from, I was a student at one point too, and I remember going into my first clinical and basically just understanding how to have range of motion and muscle testing. And that's all I knew. And yet I had to go into doing an entire evaluation and know and diagnose a patient with whatever it was that was wrong with them. And then I had you, and it was your first clinical? Second clinical. And I was prepared to teach you these things. And you came in and you were like, okay, I like that idea, but what about this? And we were able to kind of, for the first time in my practice from where I worked, I was working alongside someone who I felt was equally engaged and didn't want to just have a cookie cutter experience with their patient as well. So just knowing that someone else like that existed in the practice was a great thing.
I'm glad you feel that way, because whenever I was your student, I was like, I know nothing. I was like, great. Like Nicole is just like, she's got all these ideas, all these things going on. She can run through this eval, know everything that's going on. And I'm like, I'm just still trying to get their subjective. I'm still asking, when they hurt their pinky toe in high school. And you're like, I already know what's going on, where we're going to go from here and all of that. So
it's kind of, in a way, I kind of look at the body and injury and treatment now as almost like a dance. It's a fun dance. It's a very visually what is happening when I'm evaluating someone. I'm watching what's going on underneath their skin with their body, how their joints are moving, because once you have that understanding, it's really fun to sit there and diagnose someone. But when you're playing with what little cards you have as a student and you're just like, what am I even looking at? You don't know the whole picture. So after a while, it does become a fun experience for me as well. And I think that was the only thing that was keeping me in practice at that time, was I really enjoyed almost the adrenaline rush of figuring out what was going on with someone and making them better.
Yeah. And it was cool because, I feel like I've gotten to know you through your phases of life too, which has been really fun because, whenever I was your student, you had just married Craig. And then, I don't know, how old is Xander now?
Xander's 4.5. Yeah.
So it wasn't too long after, I guess, then whenever you got pregnant and everything. Because I feel like you had Xander when I graduated PT school.
I think so. Yeah. I had about 2 years after I got married. So if it was 2018.
So yeah,
we've known each other for about 6 years, right?
Yeah, something like that. Yeah. So I think it's really cool because I do remember you of you were leaving the clinic and then you're going to the gym to go see more clients, and absolutely you're a meal prep beast, doing all your things. And then I remember whenever you told me, about mom life, you're like, Haley, treading water here, you're a phenomenal mom, and it's just so demanding. And then added baby number 2 and, watching you do all those things. But I remember us having conversations of you were kind of just I had my time as a PT, I'm going to focus on being a mom now, which I 1000% respected and thought was amazing. Also, whenever we had enough conversations and I was trying to start Real Recovery and I was asking your opinion on certain things and your advice on certain things, I don't know. I kind of felt your itch going a little bit, and I was like, let me give it time. Let me just be patient with it, and then I don't know.
Lose your true identity.
I think I just low key texted you. I was like, want a treat again?
Yeah, I think that's exactly what happened, and I was like, what do you mean? And it's funny because this actually was a big fight between me and Craig.
Oh,
it was.
Sorry,
because
Craig. Sorry, not sorry, actually.
I know. I was like, Craig, I just want to go back to work just 2 Saturdays a month, just 2 Saturdays. And he's like, but because my husband works a lot and does a lot for us. And the agreement when I stopped working was that I would have the kids. And he's like, you mean on our one day that we get to spend with each other, you want to go work? And I was like, yeah, I think I do. And so he's like, I just don't understand it. I don't understand. And I was like, but every day's the same when you're a stay-at-home mom. There is no weekends. There is no, so Saturday sounds great. And Saturday's the only day that you can watch the kids. Saturdays it is. And that's how we started.
Yeah.
I started off just a Saturday here and there. And then the itch came back and getting my feet wet again. It felt a little rusty at first, more so with just how to talk to people again, because when you're a mom and you're in that stay-at-home life, you're talking, you don't have a conversation with babies. You do, but it's a little different. But it was so good for me in so many ways. Now, a year and a half later, I'm much more part-time. Getting more and more hours, getting more and more of that independence as the babies grow. And soon I'll have a preschooler next year. Again, he's repeating, but that's because he's young and I want him to. And I want my kids to be a year apart so then they can be closer to each other. But as that independence kind of grows with them, then my independence kind of gets back into the game too. So it's been a great experience, and I'm very glad for you sending me that random text to get my itch back.
Yeah, Craig's just gonna have to, deal with this. So I think it's important that people know what a role you do play at Real Recovery, because even though you work quote unquote part-time right now, Dr. Nicole is the strength guru of Real Recovery. Dr. Nicole geeks out on programming and loves to do out of the box things to keep things fresh and new, but to help patients progress past goals that I think they even had for themselves. Once they start unlocking their potential at Real Recovery, they then are like, wow, well, I'm excited. I want this to continue going. Right. And you're an integral part of creating that program for Real Recovery, of how to offer a client a doctor-led program that's not only going to push them physically to accomplish those goals, but is going to keep them from having an injury and or keep them from re-aggravating the injury that we just worked so hard in.
Right.
Because so many people talk about physical therapy and how many weeks they worked and did things and they felt better, and then 3 months down the road, they feel like they lost all the progress that they unlocked and made. And, with you bringing on blood flow restriction training to Real Recovery, with you kind of going above and beyond of, Dr. Nicole will always send me like research articles and things like that. And she'll be like, oh, well, I was doing some light reading last night. And it's like, a journal that's like 15 pages long. But I think that that's huge and so warranted and refreshing for so many of our clients that are coming to us from a traditional physical therapy clinic where they maybe got a printout of a home exercise program and they were like, okay, good luck.
The secret with all of those is when you go to those clinics, you're getting the same program that someone who's 20 years younger, older than you, that doesn't do your sport, that doesn't do your job, you're getting the same program.
Right.
And that's what I love about Real Recovery, and that's what I love about our patients, is they are coming to us for a personal touch. And when we're creating these strength programs and what it is, it's about to make their specific goals, but in a way that, like, when you're creating a strength program, to be realistic about what can you do? What does your body go through on a daily basis, regardless of this program? What are we stressing already that you kind of need a break from? Because I don't want you to run into an injury of overuse when I give you this strength program, even if you want your glutes to be huge, right?
Yeah.
We got to still
Dr. Nicole is known for the booty gains, by the way. So if you need a program,
we can do it. We can do it. But it's about interviewing the client and interviewing the patient and figuring out, what not only are their specific goals, but teaching them how to make those goals. And making specific goals is probably one of the hardest parts about being a therapist, but also like teaching that to the patient is extremely important, because if you don't have goals, you're not going to finish through and follow through with the actual programming.
Yeah. Otherwise, why are you doing it? Yeah.
I mean, you can be a freak and just love to work out, and that happens
like
too.
You, but yeah.
But even then, you still need some rigidity. You need some kind of programming and everything. But yeah, I think that's what's really neat about the environment about Real Recovery, though, is we have patients that are coming to us because the system has failed them, because they haven't actually had that personal experience. But also, like, they can come to us at any point of their life for what their specific needs are. So we have great modalities that we utilize to get rid of pain faster.
Yes.
And I think we have a lot of people that come to us either for chronic pain or, just to feel good sometimes, because they want to recover faster and they're not necessarily injured, but they want faster recovery from from their workouts, and to be able to provide whatever that program looks like for them along the spectrum of recovery is a really, really neat thing. Because some people, let's be honest, therapeutic exercise, which is really what gives us the long-term benefits of how we see your body getting stronger and reducing risk of injury, that takes a lot of time. And it does, and we are here to support you along that whole process. But to be able to feel good while you do that makes you want to do it. Where at my other clinic, I didn't have the ability to choose both. It was either I'm going to make you feel better and you're not going to get better overall because that's going to be it. Or, you know, here's all these exercises. I'm sorry, you're in so much pain. Goodbye.
Right. Enjoy your pain for the next 6 to 8 weeks while you do these exercises. But you ultimately are doing the better long-term thing for them.
Right.
And I think it's important, you know, like all the other clinicians at that particular clinic, they were phenomenal people, are still phenomenal clinicians. It's not their fault of the way treatment is going necessarily. It's the parameters that are put on them to produce and have that productivity quota met in a time frame. And, you know, it's kind of crazy because when I look back at all of the clinicians that were there whenever I was a student, now I think I only know 2 of them that are the same clinicians that are still there.
You do. You get burnt out from having to have all these productivity standards that don't end up helping the patient. And, you know, that brings a point that, you know, just literally this Congress session, they cut Medicare rates again. Yeah. And so another reimbursement hit for physical therapists. And when you talk about the quality of care that we can provide, that goes back to the quality of care that's provided for those insurance carriers and for the people that actually are insured. So it's a double-edged sword with all of that. And so having the ability to have the patient take that empowerment in their own hands, because to be honest, what I always hated about insurance, especially for physical therapy, is we are a specialty care. And so you're paying specialty copay. And those specialty copay rates are higher. And yet you're coming to us 2 to 3 times a week sometimes. And you're paying, let's say, whatever that specialty copay of $60, you know, is. And your insurance company isn't even paying that much for you to come see me.
Isn't that crazy? Yeah. And to that point also, for example, you know, dry needling is a huge thing at Real Recovery. That is like that's my baby. That's how I got Real Recovery started, is getting people out of pain and getting those results in a fast amount of time. Dry needling allows us to do that. It's a modern cutting edge technique backed by thousands of years of acupuncture based research and everything else too. Yet insurance doesn't recognize it. They won't cover it. And the thing is if insurance did cover something like that, and if these parameters weren't put on these therapists, we would be seeing such increased patient outcomes across the board. What I tell a lot of our patients, you know, that are coming to Real Recovery, our cash-based clinic where you have to self-pay, our rates, they look at a price per rate and they're kind of like, ooh, like that seems expensive for physical therapy. And it's like, well, that Real Recovery, you're getting more than just physical therapy. And it's the way healthcare should be. You're getting direct access to a practitioner. You're able to reach us at any time, but you're getting all those feel-good modalities with it. And then you're getting the programming with it and just everything else, right? We have massage therapy, other chiropractors, everything. And so with that, we have patients that we get out of chronic pain in 8 visits at one time a week, because they're working, they're living life, doing things like that.
And they still want to come back to see us even though they feel better, because they're like, what else can we work on?
Right. They're like, I want to stay feeling this good. But it's, you know, the rate per session times 8 visits comes out every single time lower than the $60 copay, $50 copay 2 to 3 times a week for your 6 to 12 weeks, whatever it was that was prescribed. And so, you know, every time, you know, we're saving people money in the long run, actually, and then improving quality of life with it.
And I think that also going back to the kind of patients that we have, like when you have a patient that walks in the door, for whatever reason, when you spend your own money, even though it's pretty much the same amount, if not less, people are like, I'm bought in. Like, you know, like for whatever reason, like this is where I'm going. It's almost like when I go get a massage. My insurance doesn't pay for my massage, but I'm like, yes, this is self-care. I'm taking care of my own body. Where when I would have patients coming in the door at a physician-owned practice, they were told that they had to come see me in order to get their MRI approved. And so their mindset walking in the door is already, I don't want to be here. I have to be here for this reason. This isn't going to do anything for me. It's just going to show me something. And what we see is we'll tell you if you need an MRI.
Right.
We will say, hey, this is necessary or it's not. Or, hey, give me a couple of sessions and you tell me if you want that MRI because you're probably going to be feeling better. So that mindset shift of this is for my body. This is self-care. I'm taking, my responsibility for it. It is preventative in a way.
Absolutely. And, but we actually have, because we're one-on-one with the patients, we have the time to explain to them their diagnosis, not their shoulder pain. We can do all the tests and measures to say, hey, you're supraspinatus. That's aggravating you a little bit. Here's what your supraspinatus does. Here's where it's located on your body. Pull up the anatomy app. Have a conversation through it. And it's like, normally you'd have difficulty with movements X, Y, and Z. And they're like, yes, every time. That's exactly it. But, if we do this and modify that a little bit, you shouldn't have any pain. And then we'll do it. And it's just like light bulb gone off.
Right.
Because they also were led to believe that by getting an MRI and showing a certain result, they then are going to be able to fix the pain with a surgery or with a medicine or with a thing like that, where me and you both know surgery does not fix pain.
No, and then you open another can of worms.
Surgery fixes functional deficits. Absolutely time and a place for it. Medicine doesn't fix
functional deficits.
Right.
We fix the functional deficits.
But exactly. End of the day, if you have a full tear, you have a full tear.
Right.
We're not going to bring that back together. But medicine too, people have this misconception about medicine, in my opinion, where they say, I'm in pain, I'm going to take this med, it fixes my pain. Me and you both know it's just masking the pain.
Right.
And that, pain is the body's way of communicating with us. And no one likes to feel pain. Maybe there's some people out there, but they need a different kind of therapist for that one. But in general, no one likes to feel pain, but it's important to have that communication to know if you're doing something that your body isn't pleased with, right? Maybe you're having pain when you reach above your shoulder to do X, Y, or Z because your shoulder is not stable, because your rotator cuff is weak, or because we have something else going on. And so by all of these meds that are getting prescribed, all of these injections that people are getting and all of that, we know it leads to increased tendinous ligamentous breakdown over time, leads to then a structural deficit that leads to a surgery. At Real Recovery, we're really about addressing the root cause of why are you having this pain, and let's not mask the pain, but let's truly get rid of it. Let's return the functional aspect of this and kind of get there. And, I just don't think the therapists at insurance-based clinics have the time to do.
You don't have the time at all. And that's the other thing is it's scary to a patient to learn about a structural deficit. Because what are they going to do without that information? They didn't go through the schooling that we went through to understand that it really isn't that big of a deal. Like that structural deficit could be in you and you have no pain with it. You have no dysfunction with it at all. Right. You have that same anatomical,
disc herniation,
and you don't even know. And yet they want to do surgery on me because they found it in an MRI.
Correct.
And so just teaching, talking about the diagnosis in a way that's like, okay, well, let's relate it back to function. Let's make you know and feel comfortable with the fact that like, hey, I have this problem and this problem too. I can still do all of these things. Now, there's going to be times when we get injured that the structural problem either does lead to surgery or that we might have some pain with certain things that we have to change the way we do things. But we're going to talk through those things too. We're going to figure out how to do that together. And then if you still at that point say, I'm going to have surgery, we're going to tell you the pros and the cons of the surgery because it doesn't just fix everything. You're going to be on the flip side of it and you might be running into another problem or not realize the intense amount of recovery you're going to need. And in that time of recovery, start to have other problems.
Right. Or we could get ahead of those other problems, right? Hey, you know what? You do need to have this surgery, but your surgery date is 4 weeks out. And if we have full range of motion going into that surgery, if we learn how to activate all these other muscles around it, then whenever you get out of that surgery, you're going to rehab back better, faster, stronger. And then we'll be there to hold their hands every step of the way. And while their shoulder's in a sling and they start having neck pain, we're going to address that neck pain and keep that neck from compensating so much while we're dealing with the surgical repair of the shoulder. So it's definitely a more whole body approach that we have the privilege of being able to offer by getting outside of the insurance realms of diagnosis codes, things like that.
I've always thought that physical therapy needed to be the primary caregiver of the body.
1,000.
And that's what I think Real Recovery is. I think we are able to have you as a patient once, figure out your body so that the next time you come in, because if you get hurt, it means you're living. Let's be honest.
Right.
And even if you're not moving, you're going to get hurt in other ways.
Right.
But it's just a product of life. But having you as a patient once, I already know you. So that when you come in and maybe you have either a flare up of something that you have a chronic issue with, or maybe you injured something else, I'm going to know how that relates to your other injury. And I'm going to know your psychology, how you handle injury. I'm going to know what your body goes through because I know you are a firefighter or you're a teacher or whatever your occupation is. And I'm going to be able to heal you that much faster because we already have that relationship.
Absolutely. And, that's everything because, for example, right now, the traditional model is somebody gets hurt. They think about, okay, well, if I go to urgent care at that wait time and all of that, I just don't have time to even deal with that today. I'm not hurt that bad. I can wait till tomorrow. Then tomorrow turns to a couple days from then. And then they end up going to whatever type of urgent care it is or things like that. And then they're told, okay, they do x-ray, not broken. Here's some pain meds. You need a referral to a ortho physician.
Still don't have an answer about what's wrong with you.
Still no answer. And guess what? The ortho physician, they're 4 weeks out on their schedule because they're busy, right? So now you're taking pain meds for something that you don't know what really happened. You're maybe now fear avoidant. You're maybe now avoiding things that you like to do and staying more stationary, which we know might be making the problem worse. Takes them 4 weeks to go to the ortho physician. They get in. Physician says, I want my own imaging. I want this different type of imaging. So then whatever that is, you're talking weeks and weeks again. And then they're going to say, okay, yeah, actually no major structural deficits
You're
here.
Healed.
You should just go on your way or go to PT. Maybe they'll teach you a thing or two. Or my favorite is PT one visit only. Patient education and discharge. But anyways, you're talking this is now 2 months this person's been dealing with this. Whereas at Real Recovery, people get hurt, and now that they know about it, they call us. We get them in within the next day, sometimes same day. We have stayed late how many times to see people on the fly, and we're able to immediately troubleshoot, diagnose everything, and we're immediately able to say, we need to get you an X-ray, we need to get you an MRI, we need to refer you out, or hey, perfect, we can go ahead and start treating this immediately, and address this before we even have this upregulated nervous system and everything else that cascades and follows in the weeks to come. So yeah, it's cool.
Just to be able to treat within that acuity is so important. And the patients don't understand how important that is. And I mean, I just strained my back 4 days ago and I know what to do. Yeah. And so I did my first therapy session today, did a little post about it and everything, and just took my body through what I know I needed to do. And the movement alone was so beneficial. And I'm day 3 right now, 3 days out from my strain. And I can now move so much better, where we're talking 2 weeks is what I probably would have waited for the same exercises. And then I'm dealing with a whole bunch more stiffness because I've stayed locked up for that much longer.
Correct. Because you didn't know if you herniated a disc or anything else. So you're worried about it.
Right.
And then
because you've been told that herniations are so bad.
Yeah.
They're terrible. You're never going to recover. I'm not supposed to whisper.
But yeah, so it's, I don't know, it's cool. And now we're going to put needles in it in a second and, expedite the entire inflammation process in a good way and help with the healing patterns. But I think that just comes full circle to everything that we're going to dive into with Real Recovery Unplugged as a podcast and all of the myths that we're going to talk about that are well accepted among the common people of, you got your sprained ankle, put an ice pack on it. Wait 6 weeks to return to exercise. We're going to cover all of those kind of misconceptions.
Shouldn't crack your neck.
And then we're going to delve into some hard topics too. And I'm actually excited about doing that because I think a lot of people are quick on social media to talk about, the fun things, the lighter things, but no one really wants to have that more in-depth conversation or really unveil the ugliness of healthcare as a whole right now. And, I think that's been one of the things since while being in PT school, I'm not afraid of that challenge and of speaking frankly, because everyone deserves to know.
Yeah. And this is the age of do your own research, and people don't know how hard it is to do your own research, because we had an entire course on how to research. And so for people to just read a research article, it doesn't tell them the information that you truly need to do to understand what that problem is. And so I think it would be really cool to have some of our clients and stuff bring in some, hey, what do you think about this research? And bring it to the mic and have conversations and talk about, well, this is interesting. And if you read it just on its face, it seems like this is the result. But let's go into why that could be a little misconstrued if you just take it for face value.
Your WebMD or your Chat GPT diagnosis might be off, and the plan of care might be opposite of what we would actually do.
Right. It's a scary time for healthcare in that kind of way with the technology boom, because it's very useful in many ways, and hopefully in the way that we are right now on YouTube, getting word out and from doctors, that will be a success of it. But it's scary in a lot of ways of how it could be used to give misinformation. Yeah,
no, absolutely. Well, I'm looking forward to it. I think we're going to have a lot of fun with this, and I've already gotten a lot of awesome feedback from people, and they're excited to hear what we have to say and cover the topics. So thank you so much for coming on today.
Thank you for having me.
And we're going to have a blast.
All right.
Go team. Woo.